Hello,
Good
Dr.
evening,
Rob.
Tammy. How are you?
I'm doing great. So, and I'm going to say this on the recording. In July, there's a number of schedule changes throughout the calendar. So, on the sexandrelationshiphealing.com, if you automatically save groups and webinars to your calendar, great. But in July, I would encourage you to just double check the calendar because there are some things that will have interruptions in them. So we will have it updated, the calendar on sexandrelationshiphealing.com. So follow that, but keep them in your calendar as well. So I wanted to put that in. So Dr. Rob, the first question is, I'm going to hit, okay. Thank you for the opportunity to ask questions. It's so helpful. Married to my sex addict husband for 12 years. He has gone through 5 therapists. 2 of them were CSATs. He can't seem to get sober for more than a few months. The longest he had was 7 months. And even that was about just about sober and far from recovery. So his CSAT now wants to try things on a little different. She has started doing EMDR with him on childhood trauma. I'm a bit confused by this because this Zooms and all the other podcasts and groups I go to always say that they need to have sobriety before starting trauma work. He does not even have a 3-circle plan, and I have not had disclosure yet, and he is in full-blown relapse at the moment. Any thoughts? Thank you. Lots of thoughts, I'm sure.
Well, actually, I have one pretty clear one, which is this is somebody who should be in residential treatment. Here are the criteria for being in treatment. 1, you can't stop the behavior, no matter how you try. 2 is maybe you have trauma, and even though you're trying to solve the addiction, when the trauma gets kicked up, you end up acting out. In other words, you can't look at the trauma because you act out. You can't really stop acting out because you have to look at the trauma. And so those are situations where people might come to residential treatment. And, what I hear, Tammy, I will say this is complex problems, and one of the things that you and I have talked about is that people seem to symptom shop or focus on the symptoms. So if you do if you treat eating disorders, it looks like everyone has an eating disorder. And so I really wonder about, hold on a second, I want to see this again. Yeah, well, I don't want to comment on what the therapist is doing. That's not my job. I'll simply reinforce what you said, which is I was just talking about this to someone. If I'm acting out, I feel shame and confused and guilty. And I don't understand how you can work with past trauma when you're creating situations in the present that are really emotionally difficult. I was just talking to someone who said, I really want to get in and do this trauma work. I want to do this, do that. But he's never been sober or only a few weeks. And there's another piece too. Part of sobriety, I think, I don't know what Tammy will say, it's like building up a foundation inside of you. It's like having a solid place to fall. I strong emotions. I don't go act out. I figure out how to deal with them because I'm reasonably solid inside. And without sobriety, you don't have that kind of foundation inside. And without that foundation inside, you certainly can't work on trauma because you have to be really well supported on the outside in and on the inside out to do that kind of work. So although I will say one more thing, it says he's been to 5 therapists. So there is a common denominator here, and it's him. I guarantee you in those bunch of therapists, there were 1 or 2 that were good. I think maybe the one he has is now, I just don't know if he's is really taking advantage of it when people challenge him to do things. Maybe it's just time to move on to someone who's easier. I don't know, Tammy, I could talk about this one all night. What is your thought?
Well, and me too. But what you're talking about with, I went to my 12-step meeting today at lunchtime, and somebody shared, a complex life situation, and this person shared that they had the resources and the support to be able to do that. And that's what I see with this is he has no foundation, and he can say, well, they never made me do a whatever, but I suspect somewhere along the way he's been had the opportunity to know about a 3-circle plan and some basic foundational things. If he's going to 12-step, you would hear some stuff if you're actually paying attention when you're going. So it again, Dr. Rob said the common denominator is him. And so always looking for, well, if I just go do this trauma work, then that'll be all better. There's no magic fix. There's no magic cure to this. This is a lifelong issue, and getting the foundation on which to build is how we change. But trust me, I needed a 12-step meeting this I was like, I'm going to a meeting, and I come out and I feel much better, and nothing changed except me. My perspective and attitude changed. That was it. So,
and we always appreciate that. We always do. I wanted to just note that, in situations like this, people can be depressed. They can have psychological or psychiatric issues. So what my therapist might perceive as trauma, and if you just work through this, you'll be feeling better, could also be long-term depression. And, again, he could be a complete BS, whatever, and, he just goes through them when he is done, when they push him too hard. But it could also be that, as I said earlier, when therapists focus on a symptom, they sometimes miss the whole picture. And there might be other mental health, or, maybe he has OCD, maybe there are other things going on that haven't been examined. So I would also look, so either he's full of crap or he needs more help, but from a different arena. So I just want to throw that in there.
And I'm going to ask, what are you doing to take care of you, so that regardless of all of this chaos that he's creating, and the magic shell of like, oh, just look over here. What are you doing to take care of you? We have a betrayed partner, level 1 work group that will start again in August. So check that out in the Seeking Integrity site. But hopefully you're coming. Thank you for coming to this. But hopefully you're also going to the drop-in groups and getting support for you. If you don't have a pro-dependent aligned therapist, email me, Tammy, TAMI, at Seeking Integrity, and tell me where you're located, and I'll do my best to help you find somebody. If you're working with somebody that's supporting you, great. But if you're looking for help for that specifically, because nothing you do or don't do is causing him to do what he's doing, but what do you need to do to take care of you? So, okay, next question. Hi guys, thanks for the service. I'm truly fighting for my life. I am 1 month sober from porn and 6 months from sexting. I get clinical support once a week, and have been going to 12-step for 1 month, and recently joined online Facebook groups. Over the past month, a lot of anger has come up, and I want to flip tables and storm out of 12-step. I realized how alone I truly feel, how much trauma I've left unresolved, and I've been trying to do the right things to counter that, but I've been feeling really depressed lately about it. I find myself wanting to download friends apps to make friends in a healthy way, but the urge to use porn and sexting again so strong, I delete them. This disease has taken my social life, made me lose interest in pursuing my real dreams, and it makes me feel like I'm living with a disability. I'm in so much pain. It feels like it would be easier to just end it. Should I check myself in somewhere?
Okay, there's a lot of questions in there. Let's take them one at a time, or if you don't mind, Tammy. There's two things that struck me. One is we were just talking about unresolved emotional or mental health issues, and almost everything in here is about what we call dysregulation. You're angry, and then you're want to flip tables over, and then there's something else I saw up here. Oh, I feel depressed, I feel alone, I have, so every one of the things you described, while related to early recovery and all that, to me sound like the ups and downs of depression or something like that. And I'm not out here pushing medication. I'm not a doc, but I got to tell you, I would have been able to stay sober without medication, but with medication, I'm actually able to enjoy my life. And I'm not pushing medication, but there are family issues. You can kind of see a mom or a grandfather or someone who struggled with emotional issues. They do go down in families. So in any case, this does feel to me a little bit, when someone says they don't want to live, that really concerns me. So again, I'm glad you're getting clinical help once a week, but what does that really mean? What is clinical support? Is that like a free group you go to? Is that someone at a community mental health center? Is that, what are you getting help who is giving your help? Also, if you're feeling like you may not want to live and you're feeling that helpless and hopeless, two things. One is you need to get on the phone and tell your therapist now, because that's what they're for. Number two, and Tammy would support this. How often are you going to 12-step meetings? I mean, and I really mean that, because it's not about even recovery or sobriety at that point. It's about being in a community and over again. And people are giving you hugs and they're saying hi and you're going out for coffee. And, it's really a way to get out of yourself. And I think getting out of yourself when you're feeling this way is critical. I must say one more thing that Tammy would say too, I'm sure, which is 1 month. You've had 1 month away from porn. Of course you're feeling crazy. I mean, if you drink all the time and you stop drinking, all of a sudden you're going to smack everyone like a fly. I mean, you're going to be all over the place. So stopping for a month means that maybe a whole bunch of feelings are flooding back in that you're not used to, and you're not used to managing anger, and you're not used to dealing with being sad. And if we were well regulated, we wouldn't act out. So in any case, Tammy, I see you're nodding your head. I bet there's a bunch of stuff that you could say about this one.
The most important thing is, it'd be easier just to end it all. So please don't. I'm glad you're here, but it's one of those where, it feels awful right now. This is temporary. So there is help. You're going to 12 step. You know what? It's okay to go to a 12 step meeting and go, I'm so angry, I want to flip the table over. You can say that out loud in a group, and somebody will laugh and go, yeah, I know how you feel. Like, it's a safe place to be. I don't think I saw that you have a sponsor. Highly recommend getting connected with, I'm going to 12 step for a month. Yes. So great. But having connection with people that like your sponsor, that you can call at 2:00 in the morning when you're, struggling. The strong emotions, I absolutely know how you feel. I mean, I numbed out my emotions so badly, or so well, I guess, maybe with addiction, that, having to feel emotions, they all felt so strong and out of control. And anger, quite frankly, I liked, because it was a powerful and pushed away. I didn't like feeling hurt. I didn't like feeling sad. Anger, is powerful and pushes out. So, and it kept people away. So I had to learn about that and work on all of that. But I didn't do it in the first month. It took way longer than that. So and this is one of those that they say around 12 step, you're exactly where you need, where you're supposed to be. And that sucks, but it's also true. So lean into the support. You have connections, keep leaning into those. I'm glad you're here. If you haven't already signed up for sex addiction or porn addiction 101 work groups, there's more people to connect with. Those guys, you can get more numbers and you can connect with them. You'll have a facilitator, you'll have somebody to help guide you. So all of those, things, a higher level of help. Yeah. I mean, can anybody benefit from treatment? Yeah, absolutely. Does everybody need it? No. But, for those that are able to do so, gosh, to get in a compressed time, ahead of things, it's helpful. So
I think,
anything else,
Tammy,
Dr. Ross?
I think we both feel strongly about this question, because obviously it's very serious, when you don't want to live and then you want to hurt other people. And, I do think, and I'm going to go back to this, that, people who are bipolar, they often get rageful and irritable and talking real fast and, just can't stop their head from racing. And then at the other end, they're depressed and they don't want to live and they don't want to get out of bed. And, these are symptoms of some things that I think you should really look into. Because, I'm worried about you. By the way, Tammy, and I'm worried about you. Tammy, the last two sentences, I think you should respond, because we didn't, and that probably should respond.
Well, I did, because it'd be easier to end it. And
No, I was talking about the other
that's
part.
oh, should I check myself in somewhere?
Yes, this is a
Well,
good
that's what I
time.
said, a higher level of help. Yes, yes. So we have a
Oh,
treatment
us.
program. Yeah, yeah.
Right.
So we do
Okay.
have a treatment program, for men who are struggling with sex addiction, intimacy disorder, all of these things. And great that you've got a month. We have guys that have stopped that problematic behavior longer ago, but they're still struggling with all the other stuff, because they're acting out as a symptom. So addressing the underlying issues, which that's what I think you're struggling with is all the underlying issues that are suddenly not numbed out by the acting out. So that's typical, so again, you're right where you need to be, but yes, there's a higher level of help. We have an amazing expert treatment program. Dr. Rob works with the clients who come to us. So anything else you want to add?
Yes, I'm gonna throw something crazy out there. If you've ever been, what I do when I'm feeling like this, or I would go to the SPCA and I would volunteer on the weekends and I would help
Oh,
the animals and I would clean the cages. And because there were two pieces for that, one was humility, which I always needed reminded of. And the other piece was being able to be of service in some way. I'm not sure I was ready in my recovery to help people, but I knew they would tell me in program, doing service is very important. And where can I volunteer? I love animals. And I'm not saying that you should do what I did. Cleaning up poop may not resolve your problem, but the idea of connecting with any kind of person or experience that is going to feel like you really contributed will take your mind off your problems. It really is true because you're focused on someone else. In fact, I'll tell you as a therapist, this is a long held secret among therapists. When we're having a really terrible day, it's easier for us to work with you guys because we don't have to focus on us at all. We can completely focus on you. But that's a good thing. So anyway,
no,
Tammy, do
and
we have sorry, I'm
well, we do, but I was thinking too, it's like rather than flipping over the tables, going and cleaning the tables at a meeting is like,
right.
yeah, I mean, it absolutely is service, so being the greeter, welcoming new people in. So there's so many ways to serve. So, okay. And it doesn't have to all be around 12 step either. So, okay, next question. My PASA husband and I
Porn
are
addict,
9
sex
months
addict husband.
separated. Right. Yeah. Separated since first D-Day. Since then, he continued sex outside of our marriage. The other day, he told me that my desire for monogamy is ideal. Before
Is an
we got
ideal
married,
before we get married, right?
yeah. Before we got married, we agreed no porn in the marriage. I don't see monogamy as an ideal, but as rather as a boundary we both agreed upon. What's the difference between an ideal and a boundary? And thank you. So,
Well, let's put the issues aside, and I look at it this way, and is that when you go to marital counseling before you get married, the reason for marital counseling is to determine if there are certain things that are really fundamental, that if they come up, you guys won't be able to stay together. So one of the things that comes up is, do you want to have a baby? And if one partner really doesn't want to have a baby and the other partner really does, well, that can be a make it or break it, even though they haven't ever talked about it. But if they marry because they both want to have kids, one assumes that they're both going to have kids. And so to me, this is a commitment that was made. It is part of your marriage. He could renegotiate it, but you're not guilty or responsible for saying yes. Um, you entered into a kind of agreement. He wants to change the agreement. Quite honestly, I would want to know why. And is it just about the porn? And is there anything else going on? But as I often say to guys when they're not listening to their spouses and they're saying, but I want to do this, but I want to do this is a human being. They love you, they care about you, and it's more important than whatever else is that you are doing. So, how you feel about your relationship, what is a priority for you, doesn't have to go away because the person you're involved with has chosen to change the rules.
well, and she said he has continued to have sex outside of the marriage, and porn and all that. So, and we see this often with people who have. Let's use an example of an open relationship. Even with an open relationship, there are boundaries and guidelines. And for sex addicts, guess what? Those boundaries, they can't
Right.
even live within those boundaries. So it doesn't matter where you shift the boundaries. I suspect that he will continue to, if you gave him permission to do X, Y, and Z, he's still going to do everything else in the alphabet, because that's what he wants to do. So you holding your healthy boundaries for your safety, you've been separated for 9 months, hopefully you've had an STD test because he's having sex outside the marriage. So, what do you need to do to take care of you? If he is, I mean, he's giving you pretty strong indicators of
Right.
what he wants. So yeah, at some point, what do you need to do to take care of you? So,
And I just to add to that, Tammy, I think, a separation is a time to evaluate, to sit back and see, when we sit down for coffee or dinner, because we're not living together, do I feel heard? Are they listening to me? Is this any different than it was before? Are they defending themselves, or are they interested in talking about the issues? So if I were outside a relationship examining, is it healthy for me to re-enter it, for me, for them, and I was getting this information, which is not only what I want to hear. I'd want to hear you're the most special person in the world and that I can't imagine being with anyone else, and every time I think about it, I realize that I love you more than I do having casual sex. That's what I'd want to hear and would make me move forward. If I heard, well, I know we're apart, but monogamy isn't really an ideal. In other words, what you think and want is wrong, and aren't you going to change your mind so that we can get back together? This is a big red flag. I'm not sure that I would necessarily make on the 10th month move back in. This is moving the other way toward apart. And by the way, he may be telling you, I don't want to be with you, and crossing a boundary that pushes you away. But I really think you should not question yourself. I don't think it's very hard to see what's going on here.
Yeah,
So what's next? Oh, sorry.
no, that's okay. We can love people that just can't love us back. You can have an ideal for a
Mhm.
relationship and go, well, when I said I do, this is what we planned on. Yeah, but addicts are notoriously good at hiding things and gaslighting and everything else. So I'm sure he hid things from you even when you got married and said I do. So I'm sorry, but
And by the way, if you say it's an ideal, um,
mhm.
then you're anything. Well, anyway, you go ahead, Tammy. I wanted to say something about that. Just give me a
I'm
second.
like, I know lots of people who can do that ideal. So, okay. Hi, thanks for
Right.
your great
Go ahead.
work to help with SA. It's my understanding that SAs don't have the emotional development to be emotionally available to their partner. Does that develop by working the 12-step program, or are there other things necessary for them to connect with their emotions and the emotions of their partner? That's a great
Why don't you
question.
start, Tammy? I think it's a good
Well,
question to
I was
use.
thinking Dr. Rob wrote a great book called Out of the Doghouse, which is about so going back to yes, I think we are all emotionally stunted, quite frankly, because we find ways to deal with our emotions, like we were talking about in the first question of like, or second, whatever, the question about the emotional upheaval that is happening. We do a really good job of tamping all of that down by finding all of our maladaptive coping mechanisms called addiction. So all of a sudden we have to start dealing with that. It's confusing. We don't know how to do that. Can we learn? Absolutely. But it's a great question that you're asking. Can he do it just by the 12 step? I suspect get a long ways. It'll just take a while, but you start learning to have empathy with the other people in the 12-step rooms, and you start learning to do some things, in a safer place than your primary connection with your spouse, that, it's more vulnerable for you. Are there things that would help? Absolutely. We have an Out of the Doghouse work group that will be starting again soon. But yeah, I mean, a really good therapist, working on those issues. But and on some point, it's like we have to learn to tolerate the uncomfortable, which is dealing with our emotions, and we're not good at it. Your thoughts, Dr. Rob?
Yeah, I don't, and I don't mean to make anyone feel uncomfortable, but I don't know that you're talking about someone who's sober. I mean, I didn't say essays don't have. I don't hear, my partner's sober. So I'm just wondering about that part. But
That would
I
be,
always,
yeah, like impossible otherwise then. So yeah.
um, and the other piece is, sorry, Tammy, that um, we in 12 steps, we learn how to be sober. And over time, yes, you're right, we learn how to treat people well. But emotional development, empathy is a late stage part of development. Empathy, I have to really be compassionate for my own crap before I can be compassionate about yours. And that can take a while. And we've been through a lot of stuff that we've spent a lot of time trying to not have empathy and do the things that we want to do. And now we're being asked to actually pay attention. And it's a long process. So I often have spouses, don't we, Tammy, who say, well, my so-and-so husband and wife is sober, but they are still acting like a jerk. I'm using the polite language tonight. And yeah, it takes a lot longer. Sobriety, when you get it, you can get it for hopefully for a long period of time. But becoming a better person, that takes a long time. And that takes therapy and that takes 12 step. But it does take being around people. People will shape you like nothing else. Uh, Yeah, and the emotions of I agree with Doghouse. Take the course, have your spouse take the course, have your spouse read the book. I'll make 10 cents, but um, he will understand at least the words that need to be said and the attitude that he needs to have in order to begin to understand your pain and make it better.
Yeah, I
Yeah.
agree. And I appreciate the book. I really do, but I really find it's better in a work group because, it's easy to read a book. I mean, I've said this
Well,
before. If
thanks.
we could read a no, but if we could just read a book and
Oh, well,
I
there's that.
magically get it, it's talking about it to other people, having someone else say something and you go, oh, that makes sense, me too, so it really, and you do read the book as part of the course, but I really think connecting with other people, that's absolutely how we heal. We can't do this in isolation. We can't just read a book and be all better. So the more he practices, with safe people and that he doesn't care about, that's helpful to learn how to do the things that he needs to do with you. So, but I agree with Dr. Rob. If he's not sober, I mean, if he hasn't done abstinence yet, then then he's in active addiction, and the empathy and active addiction are incompatible. So, hey, Dr. Rob, I was this person has been through our program before. His parents are going through a divorce. My mom is still cheating on my dad. My father overshares with me. Is there anything I can do that
Okay.
doesn't include just
I'm
running
sorry,
away from this?
Tammy, I haven't found this. It's not in
This
the
is
answer. Can you give me a
503
time?
and the answer
503.
503. Uh-huh.
Okay, got it.
Yes.
Okay,
So this
got it.
person is, yeah, you got it. Okay. So
Oh, I'm sorry. You have to point it out again. Like I got 503. So,
okay, so my mom is still that my parents are going through a divorce.
right,
My mom is still cheating on my dad. My father
right.
overshares with
Thank
me.
you.
Is
I
there
see it
anything I
now.
can do that doesn't include me just running away from this? Yeah.
Well, boundaries are a hard thing to do when you've been around people like this your whole life. I always found, Tammy, that I turned into a kid when I was with my parents. Like I'd be an
Hmm.
adult in the world, but when I'm home for Thanksgiving, I felt like a 5-year-old. So,
Hmm.
but these dynamics you're talking about are how you ended up with a problem anyway, enmeshment and oversharing and watching sexual behavior. This is how you got here, meaning that this is the trauma that you experienced. So to be around it more is to hurt yourself more. And I often say, your parents are grown, they're adults, they've had a lot of their life. You're just beginning yours. And so you really need to focus on less on them and more on you. So running away, here's what I used to do. I would go see my family every weekend. I would see them a couple of nights a week when I was younger. I would not live there. I would find friends to live with. I think what people struggle with boundaries is, oh, I can't see them at all, or can't talk to them at all. Yeah, you can, as long as they're not abusive, but can you put a limit around it? Like, oh, at 3 o'clock, I have a meeting. I'll come to visit you for lunch, but I got to be gone at 3 o'clock. How can we protect ourselves from long periods of time with people who we feel uncomfortable with? And by the way, what's going on with them, it's so none of your business. It's so none of your business. You have your own struggle. If you're on here, you have your own challenges. They need to deal with theirs. And part of we talk about program is surrender. And you're going to have to surrender that they have their own problems. They are who they are, and you have to survive and do well on your own. So all you can do is, by the way, I like your instinct. I think the idea of running away from this is a really good idea. And I would wonder why, why not? Why not run away or find some place to be safe? Anyway, Tammy, do you have thoughts?
I do, because I was like, without having to physically run away from it, you can. Healthy boundaries are like, Dad, I love you. But you and Mom's problem are your problems. I love you. I love Mom. You guys, if you need resources, I will help you find qualified professionals to talk to. But I'm your son. I don't want to talk about your sex life or whatever. I mean, that's like it will be challenging, but I bet it will be freeing on some level too. And if every time just say nope, that's love you, having lunch, not talking about that, let's talk about
Right.
this. And the other challenge is like is your dad asking you how you're doing? Like, is it a two-way
Mm.
street, or is it all about, is it all about him? So whatever you need to do to protect yourself, but stating clear boundaries, reminding dad or mom, this is where I want to talk to you. These are areas I will talk to you, but this I just can't get involved with. That's between you and the two of you. So I think you can do it. So
I was just going to add one more thing, which is, they're going through a divorce, and even if you're an adult, watching these people separate and be angry at each other and try to figure it out, which for them is not easy. It's going to be hard for you too. And I don't think you have to run away, but you have to be careful about, as Tammy said, getting into it with them or taking sides, or, she's doing this and it's not your problem. You're going to feel bad
mhm.
about it. You're going to be affected by it, but this is their issue. And I think what you might think about doing is grieving these parents that aren't together anymore. And what will it mean for you if they aren't together, and where will you visit them, and all of that. So I think you have your own work to do, which is about what is it like to move away from this thing I grew up with, and let them do their thing.
Yeah, I mean, they're really showing their humanity and in all of this, as well. So like parents that, we hold our parents up to be a certain way, but like the brokenness between the two of them. So, but that is their issue, and whatever you need to do to hold a firm boundary, just remember, you didn't cause their problems. You can't fix their problems. You have like Dr. Rob said, you've got enough to deal with on your own. So what do you need to do? And if you need something from them, it's okay to say, this is what I'm looking for from you. Can you give that to me? If they can't, just understand that that's where they're at least for right now. So, but I'm so glad you're here. Glad to see your name. So yeah. Okay, next question. Hello, Dr. Rob. I'm a porn, chemsex, and fantasy addict, and have been sober from chemsex for almost a year, but still struggling with porn and objectification. I have completed Sex Addiction 101 level 2 and 3. Yay. I attended 3 support groups every week. Recently, I've been relapsing to porn every 4 days due to work stress and anxiety, and my social media use, only YouTube, has skyrocketed and I find it hard to focus. Is this the addiction trying to fight back? Any tips? Thanks.
Well, if you want to start, Tammy, go ahead. I mean, I I hear a little blaming here, or at least writing is sometimes difficult and people don't mean exactly what they mean. But when you say, I've been relapsing on porn due to work stress and anxiety, and everybody has work stress, everybody has anxiety, everyone has SHIT going on. The question is, how do we deal with it? If I'm miserable at my job and I go run and then, spend time with a friend, I could do that. Or if I have a really difficult time, I can go out and act out, so I don't think putting together your stress and anxiety with I acted out, that may be true, but it's not an excuse for acting out. I acted out because I wanted to. You could have gone for a walk, lots of things that are there. The other thing, I bet Tammy's going to say this, is what kind of support do you have? When you feel like that you said that you go to 3 groups. I didn't hear anything about, and I have a sponsor and I have friends there, and I've learned that I have to call them sometimes twice a day, or sometimes at the beginning of work and the end of work. How do I deal with my stress? I can tell you, when I get stressed, when I need most is support. And what I feel most is I need to do it by myself. And why am I so stressed? And what's wrong with me? And I just attack myself. This is when you need other people. So I wonder, when you feel yourself under stress and anxious, and can you turn to people instead of social media? Can you get away from your computer and connect with people? Because people are the answer. Relationships are the answer. They're the answer to stress. They're the answer to anger. They're the answer to loneliness. I'm not saying relationships cure everything, but they're a great foundation. And so the more you can build, especially with people in recovery, that's going to keep you floating.
Well, and while I'm glad you're here online, I'm also going, yeah, like everything I'm hearing, it's YouTube and like
Mm.
When was the last time you went for a walk? When was the last time you called, one of your peers in the groups for coffee? Like so I want to back up to, I've been sober from chemsex for almost a year. So yay, really, I can't affirm that enough. That said, I agree with Dr. Rob. It's like, you've got some tools, sex addiction 101. What do you need to do to shore up what you're doing already? It isn't enough. I talked a bit ago about the underlying issues. So yes, stopping the behavior, that's the first part of it, but addressing those so that when we're stressed and anxious and whatever else, we don't just go to YouTube or whatever else or porn. We're going like, what do I need to do? And having that plan, like if you've been to those groups, you have a 3-circle plan. You already know you've slid into the middle circle. You're not acting out you're not living in your outer circle. I don't want to use that count. You're not living in your outer circle. So what do you need to do to get back into your outer circle so that you aren't sliding right back into your inner circle? So you have some tools. I just have a feeling they're laying on the ground and you're not picking them up, when you need to. Which then they're not as helpful. So yay that you're sober from chemsex. Glad that you're doing that. Glad you're here. But really lean into, what else do you need to do to, to make sure that when you're feeling anxious and stressed out. I went to a 12-step today because I was like, I am not in a good headspace, and I was like, I just don't feel like doing that. So I went to that was the right choice. So, you can do that too. So.
I
Okay.
just wrote a couple other things down real
Yeah,
quick. I
please.
didn't hear anything tell me about a relationship here. And so my guess is that you're single. And if I were getting close on a year, I mean, I might be thinking about, I hope you're thinking about who might I date and how might I go out and date. And now that I'm been sober for a while, and because I think that we can get, I hear you saying, I've gone to every one of the courses and I go to 3 support groups a week. And it's kind of like Tammy said, what do you have to look forward to? What is fun? No addict stayed sober because they went to enough meetings. What is the point of being sober if you're not happy? And so this isn't why in AA they have sober dances, because young people, new people to AA think, oh, well, I'll never have any fun if I'm not loaded. Well, actually you can. So I'm wondering, do you have a relationship to look forward? Are you sitting with your sponsor and saying, if I were to start dating, having something to look forward to, I think recovery is more about what we do than what we don't do. So as Tammy said, what are you doing to support yourself and enjoy your life? The other thing I wrote down is anniversaries are tough. People really struggle when they get a year, when they get 2 years, there's something about that date that somehow, I don't know, Tammy, how would you describe it? I guess we get overconfident, or what do you think?
I think it's both. It's like the pink cloud kind of disappears. It's like, oh, it's been great. Oh, crumb, I got stress at work. Oh, like reality also bites. So yeah. But I do think people kind of rest on their laurels a little. I've got almost a year. Like I've got this thing figured
Right.
out. But what you said, my therapist in treatment said, if you don't make recovery fun, you aren't going to make it. I worked really hard at making recovery fun. Like I know she was right. But she point blank said that to me. I still remember her with her steely gray eyes saying, if you don't make it fun, you won't make it. And I was like, I'm going to make it fun because I wanted it bad enough. So,
I'm
okay,
writing
next
that down,
question.
Tammy.
What do you, what do you
Right.
recommend when going through relapse and trying to stop? In intensive therapy and 12-step meetings multiple times a day.
There's a lot in that question.
Yeah, I know it's a short one, and I'm thinking that too.
Well, what does it mean to stop? Are you very clear about your plan and your recovery? How are you, again, is there something you can do to enjoy yourself other than relapse? Um, and I want to go back to that one, Tammy. Again, I've heard people say to me, this is what I do. I'm meditating, I'm going to groups, I've been to therapy, and I go to 12-step meetings a week. And why aren't I really sober, enjoying my life? It's because you don't have a life. So I'm not trying to encourage you to go out there and make yourself vulnerable, but I do think that you have to have things that you're enjoying. It doesn't sound like you're not doing a lot. It sounds like there's a lot here. Very related to the last question. What do you think, Tammy?
I'm wondering because I'm I'm going to intensive therapy. I want to know, I guess, if it's intensive therapy around these issues, because people go to, kind of generalist therapists and they're not getting this particular work. So if you are, that's of interesting note. But I'm also kind of going, what happened before the relapse? Like, was there a life situation? Was there, something that happened? Kind of doing the autopsy on what happened that caused this relapse, because it sounds like if you're in relapse, that means you had a period of time where you weren't, so that you were abstinent, you were sober, maybe even in recovery. I know people that have had years and then they relapse and then they're struggling. So I would be curious what was successful for you before and what might have happened. And it doesn't have to be this big thing. It could be a series of things. It's people, stop doing what they needed to do, and then they get, caught in the trap of acting out. But, can you for today not act out? And then tomorrow, can you for today not act out? It's just for today, 24 hours, sometimes a minute at a time.
And sometimes it's an hour.
Yeah.
I wrote a couple of things down just to add that. And one of them is, if you're really struggling with relapse, you have to make yourself more accountable. It's much harder to relapse if you got to call someone at a certain time, or you got to meet them at a certain time, or because then it's not just about me, it's about my connection to them, and then I'm responsible to them. And then if I'm late or I don't show up or I don't, so this means make plans. I can tell you, I don't think I've said this in a while. There are two things I know because of COVID. There are two things that absolutely are going to be times when we are vulnerable as sex addicts. And one is going to be travel. That's why I forgot that one. And the other one is unstructured time alone. So one of the most important things when you're sitting around is to not have a plan, is to have a plan. Even if it's, I'm going to watch a movie in this hour and then I'm going to talk to this friend. And even if you have to schedule in calls to friends, it's really important when we get alone with a period of time that we have some way to connect. And that was the last thing I wanted to say to you is the more people you have in your life, the more activities you have with people, the less likely you're going to act out, because a lot of in the deepest sense, it's about being lonely and trying to connect. And we have to work very hard at staying connected so that we don't have that emptiness inside of us. And we are responsible for actively doing that. So good question.
Yeah, no, it's all good. I had somebody that shared that they listened to one of the Sex, Love, and Addiction podcasts. Every time they even thought about relapsing, they plugged that in. And I was like, great. That they had a plan and they executed that plan, and that kept them from relapsing. I was like, great. And then call a friend or whatever. But at least in that moment, they had a plan. So, okay. Hello, Dr. Rob. I'm a porn and fantasy addict, and when I read symptoms for depression, anxiety, and ADHD symptoms, I feel like I have them all. Are these after because of porn addiction? Can you explain why does this happen, and do other forms of addictions have the same symptoms as well?
I'm writing this down in an answer because I'll forget. Okay, so this is an indirect answer, but when I went to get my master's in therapy, they would tell us all of the mental health disorders. And they said to us, be careful because you might have graduate school disease, meaning, oh, every time you heard a disorder explained, you think to yourself, oh, that must be me. Oh, that must be me. So one of the things is I think you're spending too much time on the internet looking at this and looking at that and saying, is this me? Is this me? Is this me? I absolutely, when I don't think this is a question you can answer by yourself. And this is absolutely something I would go see a psychiatrist for. I mean, an MD psychiatrist who can listen to your symptoms and see if there's something else going on, because it may not be, like you said, you have depression, anxiety, ADHD symptoms, and I have them all. Well, maybe it's time to go see someone who could diagnose you with what is actually going on. Tammy knows this. I am not, I never push medication, but it makes me really unhappy, when somebody's life could be better. If they simply, if you had cancer and you had to take this medication, you would. If your heart would beat better, you would do that. But somehow when it gets to depression or anxiety, people say, oh, I should just power through that. And so I really encourage you with all of these symptoms to go see a professional and get figured out what is related to stopping the behavior and kind of feeling all that stuff and what is overwhelming. Thoughts?
Well, yeah, and I don't know if you've stopped. That was because I am a porn and fantasy addict, and I'm not sure if you have stopped. Um, all of those things swirling around, absolutely, they all make sense, and things can be exacerbated. I think really making sure that you're working with a professional that gets addiction and and all of those things, and not your general practitioner who hands out pills to everyone, the same dose, the same pill. You really do want someone who can identify what you really have in conjunction with the other things that you have going on. So, but absolutely, are you gonna I think everybody who stops the addiction is depressed, and you asked, is it just sex addicts? No, it's every addiction at the core, is it's all the same. How we act out, in combination sometimes with other behaviors, that's just how we're, I call it maladaptive coping mechanisms. We're trying to use all of those things to make us feel okay. And so, depression, anxiety, yeah, all of those things. Could you have clinical depression? Yes. Could you have a clinical level of ADHD? Yes. Email me. And I will send you a link. There was a really good, actually, there's a podcast on it too, on sex, love, and addiction. Dr. Todd Love did a podcast with Dr. Rob on ADHD, but he also did a webinar on it, and it was jaw dropping. Like, it really is important to treat that. So, so getting, it's like everything else, get the right diagnosis, get the right help. That's how we improve. So next question.
And
Go ahead.
but I'm sorry, ADHD and sex addiction, if you remember this, Tammy, it's the only diagnosis that we can put together. In other words, about 20% of people who struggle with sex and porn addiction are also ADHD. So, and of course, it comes from a more primitive part of the brain. So we're wired, some of that stuff wired together. We don't know how. And of course, if you treat the ADHD, that doesn't mean you're going to stop acting out. But we all are dosing ourselves with intensity and serotonin and dopamine and all of that stuff. What is going to make us feel better when we don't have the intensity to make all that happen? It's sort of like withdrawal from a drug. You might feel really good while you're using it, but you feel really bad when you stop. So it's similar. You're going to feel really rhapsodizing your sexual acting out, but when it goes away, it doesn't just, you're not just even, you're down one, and it will take time to stabilize. One more thing, addicts don't like to have feelings. I know that may be a surprise to you, but I don't want to feel. I like happy, and I really like fun as an active addict. So you were talking about this before, Tammy, actually, when you were in treatment. But I do not like frustration. I really don't like disappointment. I really hate feeling responsible for things when I am. So, I used to be able to sail through all of that stuff because I was so focused on acting out. Now I have these feelings and I don't want to. And because I remember saying this, what's wrong with me that I feel like this? I remember that. And someone had to say that that's how people feel when this kind of thing happens. So you may have been out of touch with yourself for such a long time that maybe what's happening to you isn't diagnosable and isn't horrible. I don't know. But maybe it's just you're adapting to having feelings on a regular basis related to the things that are happening. So we covered the bases on that one, Tammy.
Yes. So the next one, PA spouse is telling me until I give everything to him, he will give nothing to me. 42 years married, but I have not worked outside the home other than our business most of those years. He retired, but has gone back to work. First therapy tomorrow with someone he says is familiar with the issue, but not a CSAT. He claims God healed him in 2015, but has played X-rated sexually explicit games for the last few years. I feel I take a few steps and he wipes it all out. Any suggestions to stay steady? I am so sorry. Wow, that hurts.
I'm always sad. I'm always sorry, especially when relationships have been together for such a long time. Because I know, and this is a lot of context, but I'll say it, I know how often people say, oh, we've been married 40 years. And you want to have that pride and that excitement when you have that kind of time together. And to say we're at 42 years and this is going on is really, really difficult. And I am sorry for you for that part. But I did want you to break this into questions, Tammy, because there's a kind of a lot of stuff here and I'm not sure how to lay this out.
Yeah, the first part of it is the porn addict spouse is demanding that the betrayed partner give him everything or he'll give him nothing. So,
But
or
what
give
does that mean?
her nothing.
What is
Well,
everything?
I assume it. I assume, because this sounds like very financially tied, I haven't
That's
worked
what I
out.
was
So,
thinking.
so unless you give in to me and meet my demands, I'm going to make sure you have nothing. And
Right.
is saying, I was
Got it.
magically healed in 2015, but the actions have not aligned with what the word said, which is, so, but the big question is, how do I hold steady in this despite what the addict is saying? They're going to a therapist that is not trained specifically in this. Says they are, but they're not a CSAT. So CSAT is Certified Sex Addiction Therapist. It's 150 hours of training specifically after you already have a master's level or PhD level mental health degree. So it is specific training. A PSAP is different. A mental health that we're talking about complex mental health issues, if you haven't figured that out already. So it's challenging, but yeah,
Well, I
I
wanted
saw
to
what you
say
put.
if yes, and I'll explain that. And I don't say things like that very often.
No.
You said, I mean, you said that this might be about some kind of divorce, from what I'm hearing, or there's some kind of separation, and this person doesn't feel like they have. Is that what I'm understanding? That this is a divorce kind of situation?
Well, I don't think what I'm reading is she doesn't want a divorce. Like, there's no
Right,
divorce
I got that.
pending, but if there was, he's going to make sure she gets nothing, which I don't
Okay,
even think
so
in most
that's
states
what
is
I,
legal. So
right, so
yeah.
that's what I wanted to address, and that's why I wrote the word I wrote, other than other things, is that you need to get a lawyer. Like, you need to find out your rights, and don't go on, you don't have to go for a divorce. You don't even have to go for a financial separation, but you really, really need to know, after 42 years, and you worked here and he did, what are and it's different in different states, so I would, in California, it has to do with the amount that I made before we met and all these different kinds of things. But I really think especially since this person's saying they've been healed, but they're acting out sexually and they're demanding of you, and you're taking steps forwards and they get wiped out. This all just sounds like I want you to be protected. And I'm really glad you're here, because I don't want you to have given up on the situation. I hear you are asking for help. And the help we're giving, or I give, may not be what you want to hear, but you can't. It was like we said before: boundaries are to protect yourself. So you need the boundaries that helps you sleep at night, to understand what legally you have a right to, and what kind of jerk says that, puts that on the table. I just think that's awful. So anyway, I hope that you get support for dealing with this threat that's in your relationship that you don't deserve.
So I have a whole bunch of things, but I'll keep it short. I agree with Dr. Rob. I always say go talk to legal professionals. Know what your rights really are, because the stuff that you make up in your head is probably not exactly what it would look like. And just knowing what it is, information is power. I would ask your therapist that you're going to see tomorrow. Hopefully, you've got a copy of Prodependence. Page 75 talks about the codependent language and the prodependent language. I would ask to make sure that the therapist is using the prodependent language, so that you are not getting sucked into blame and being pathologized for your support for 42 years, including in the business. My goodness. So I would look for, what do I need to do for my safe boundaries? Boundaries are not punitive. They are, how do I keep myself safe emotionally, financially, physically, legally? What do you need to do to protect yourself? Financially is a big one for you, because I hear that's the underlying threat with this is, like, I'm going to take everything. Well, yeah, there may be some place that can still happen. I don't know where that would be. So, but what a horrible non-relational way to act. So,
Well,
this person's in active addiction. I mean, there's just no other way to cut it. So,
yeah, and I want to, I know that Tammy doesn't like me using the word run, and I rarely, rarely use that. But in this case, especially since you've been together so long, I want to give you a little push. What you're putting up with and what you're talking about here is not, it's not something anyone I loved I would want them to put up with. I certainly wouldn't want a woman who'd give her heart and soul to a relationship for 40 years told, well, you're lucky if you get some of this. I mean, that sounds like a big power thing. And then the lying and looking at the games, and it just feels like you're in a situation you really need to create a little space between you and him. And it may not be time to run after 42 hours, but 42 years, but run to a lawyer, run to a therapist, run to situations that help provide you with more information, more support. And by
Yeah.
the way, there is a betrayed partners group that we have that is running ongoing, and maybe she wants to stop in and listen to the other. In fact, I'm going to guess and say might be someone for the posse.
The old lady posse, they named it, we didn't, but it is, for people who have been typically in longer term relationships. It's tomorrow morning. Highly encourage you to do it. And I'm thinking run. I'd be heck no, lock change the locks. You've said that before. It's like, why do
Right.
you have to run?
Right.
Change the locks. So and I'm being a little tongue in cheek, but I really, yeah, I'm with Dr. Rob. I want to empower you. What do you need to do to take care for yourself? Here's another thought. If this was, I don't know if you have children, but if you have children, if this was your daughter in this position, what would you encourage her to do? If this was your best friend, what would you encourage her to do? And how would you encourage her to protect herself financially, physically, all of those ways? And like, be your best friend, be your mom. What do you need to do to take care of you in all of this? And not I mean, addicts are manipulative, and I hear all the stuff going on, so I really am advocating for you. So
And this is mean. It's beyond me. It's just plain
yeah,
mean.
yes, 42 years, and it's like that. It's like, oh, sorry. I'm sure he's a
We're
very nice
supporting
guy
you.
in
We are
a lot of
supporting you.
brokenness. So yeah. So okay. Next question. What are some signs that it's time to end a relationship with an SAPA?
Well, I would say when you become indifferent.
Yeah.
That's my best answer, is when you're not furious with them anymore, when you don't desperately love them anymore, when you just kind of feel like, I can't do this anymore, and I don't want to. When a part of you has moved on. I mean, there are lots of trite ways of saying this, like when if you don't love them anymore, or if you can't ever possibly trust them, which I think is an important thing. Um, I also, I like the person above you. A lot of people have been putting up with things that they would never let someone they love put up with, but they put up with it, and usually put up with it because you love this person and you hope that things are really going to get better if you hang in there. But you got to look at your history and say, how do I have reasons to be hopeful? Am I just clinging on to hope because it's more comfortable for me than the idea of moving and shifting? So I think this is a tough one to answer, but I will say that I say that the opposite of love is not hate, it's indifference. And so, if someone says to you, I can't stand you, they're passionately engaged with you. If they say, I don't really care what happens, then they don't love you. And so I would look at myself and say, am I deeply and passionate? I hate you. And because I don't think that is a good time to leave. But are you at a place where you just think, yeah, I don't want to do this anymore? To me, that would be a sign.
Yeah. And I have seen this so many times too, where like someone may know in their head, like but they don't in their heart. And then you see that those two places have connected, and then they have accepted that, that acceptance of, it really is time. I've given this, everything I can give, and it's time for me to move on, or, it's time to end, and it doesn't have to be like, there are some relationships, even if people are in recovery, that are just, not really a good fit for people. But when somebody is being cruel and is not showing any signs of moving forward, is that what you want? If you vision, I say this often too, if you vision this, 12 months, 24 months, 5 years from now, and it's the same or worse, is that, are you okay with it? And you can be like, no judgment. Are you okay with that? Do you have healthy support in place for you to be okay, regardless of what, the other person is doing? If you do, you can, lots of people stay. But if you don't vision that, then sometimes it's kind of like telling for you. So,
I have
okay.
one more comment about that, which
Hmm.
is I read words very carefully, and I don't know if they're correct when someone's typing here, but you said, I think you said, what are some signs that it's time to end a relationship with a sex addict, porn addict? And what you didn't say is, when do I know that it's time to end a relationship with my wife or with my husband? Or because they're not just a sex and porn addict. They're also the person that you did this with and did that with and own this with and have. So, you're not just ending a relationship with someone who has these issues, you're ending the whole relationship. And so part of what I read into this, and please excuse me, is a little bit of anger or a little bit of, this kind of thing. And yeah, you're not just getting rid of the addiction by getting rid of him or her, you're also getting rid of everything else. And sometimes when people are angry, they don't necessarily feel that way. And thank you. I can't say your name, but thank you for the nice note. We just got a
Yeah.
nice note.
Yes. So yes, I saw that. So yeah. So we are out of time, and I know we didn't get to a lot of questions, and I scanned through some of them, and they're really good questions. So please bring them back. We promise we'll do our best to.
We'll be
So
here.
come join us again. So yeah. But join sexandrelationshiphealing.com. Drop in groups, other webinars. Check the schedule. Like I said, for July, it's going to be a little different. And the work groups, you can find them on seekingintegrity.com. Great foundational components. And we have an amazing treatment program, as one person can attest, that's on here that really helps men change. You've changed my life for real. That's a quote from a former client. So grateful
Thank you,
you're
Tammy.
here. So
And you
thanks,
changed
Dr.
my
Rob.
life for real. Have a good night.
All right, take
Bye,
care.
folks.
Bye.